Well, thank you everybody for letting me join you here today. And yes, so we're going to talk about diet and nutrition in IBD. This is me. I am Levi. I am a dietitian and researcher again at the University of Minnesota. So we're going to start here with this first slide, and what this figure, or what this picture is showing you essentially is that on the left, the majority of patients feel that dietary guidance is important in IBD. And this graph is showing that about 85% of patients responded that yes, they feel that dietary guidance is important in IBD. But unfortunately, what we see on the right side of the screen is that only about 10%, maybe up to 15% of patients actually feel like they receive a correct or an adequate amount of information on diet in IBD. This is in large part, due to the fact that we don't have a specific diet for treatment of IBD. So for something like celiac disease, we can treat it with a gluten-free diet. But for IBD, we don't have that one specific diet. That's not for lack of trying. As they alluded to in the previous presentation, there's been a number of studies here, even just a number of which have been published in the last couple of years on a number of different diets. We saw on, again, the previous presentation, this Crohn's disease exclusion diet. This one is becoming increasingly more popular. Mediterranean diet, the specific carbohydrate diet. In Japan, they use what's called a semi-vegetarian diet. And even most recently, they did a study where they just very basically did a low-fat, high-fiber diet in patients with ulcerative colitis. And so we have all these different diets out there, the general theme of which is all kind of consuming a less processed, higher fiber sort of a diet. So the one you're probably most familiar with is Mediterranean. So you think Mediterranean, you think fruits, vegetables, lean meats, minimally processed sorts of foods. But this, unfortunately, contradicts with what you receive, especially in the hospital, which is oftentimes just a handout that says a low-fiber diet handout and just says don't eat any fiber. And so this leaves you, obviously, very confused. And so what we're going to talk about today here isn't going to be any one specific diet. What we're going to talk about is just, again, and this is, again, what they mentioned I really liked in the previous presentation, is how we can use diet to help us feel better. And so there's some very basic concepts that oftentimes get overlooked that we can easily focus on that can help you hopefully feel a bit more empowered when it comes to making food choices. So the first thing that we're going to talk about, and this is what we're going to spend the most amount of time on, is just going to be the very basic physical characteristics of food, or the particle size. This is essentially, you could lump this in, this is essentially going to be addressing the concept of fiber. We'll also touch on things like the fat content as well as the osmotic effect of food. What's important here is each one of these concepts is going to apply to any sort of intestinal function. So whether you are somebody with an ileostomy, or whether you have something like ulcerative colitis, it doesn't matter. These are all just very basic. This would even apply even to just IBS, so just basic GI symptoms. So these are going to be very universal, broad concepts that we'll be talking about. So we're going to start talking about the physical structure of food and the fiber content of food, and we're going to talk about it in the context of what happens if you eat plastic. I don't know how they found participants to participate in this study, but it's really cool, and it really underscores what it is that we're trying to get at when we're talking to you about fiber. So fiber, unfortunately, is this very broad, it's this really broad term, too broad actually to be used oftentimes in a meaningful way when we're talking about diet. It's a term that actually originated it's fairly recent in the 1950s. This whole notion of dietary fiber is actually, that specific term is actually fairly new. But so what we really care about, and this is what we'll talk about through plastic here, is what we really care about when we talk about fiber is that particle size of the food that you're swallowing. So what you can envision essentially is when we swallow food, whatever that particle size is that we swallow is essentially how it's going to move through our intestines. So if we have something, let's say carrots provide a really nice example. They're going to come up a couple times throughout this. But let's say we have a raw carrot. We eat a raw carrot, we swallow it, we have these larger chunks. These larger chunks move through our intestines. They're hitting against the intestinal wall. What we'll see here is that they're going to be very irritating. They're going to make stuff move faster. You're going to get more water pulled into the intestine. That's really what's disruptive. The alternative, same amount of fiber, same carrot, but if we cook that carrot, we get it down in more of this pureed sort of a consistency. All of a sudden, even though it's the exact same amount of dietary fiber, the effect as it's moving through your intestine is going to be totally different. And so that's where, and this is where this cool study comes into play that's going to use plastic. So what they did here very specifically was this study was trying to answer the question, which matters more? Is there something inherent in the grams of fiber that we're eating that has an effect on that kind of laxative effect in our intestines, or does it have to do with the actual particle size? And so what they did is they had participants ingest a little equally measured out containers of either plastic flakes, which were meant to mimic, in this specific study, it was supposed to be like minimally processed wheat bran, so think of like a really whole grain bread with a bunch of nuts and seeds, that sort of stuff, versus granules. So this is just going to be straight, think of this like all-purpose flour. And so they made plastic, they made a point of measuring under a microscope to make sure that it was the same. They had the participants consume plastic flakes that were either very similar to that wheat bran sort of a fiber, or plastic flakes or these granules that were very similar to flour. What they did for this study was they had all of the participants consumed both of these things. So what they did is the participants ate their regular diet for about a week. They got some sense of what's your bowel movement pattern, what's your normal bowel movement consistency. Then they entered what's referred to as the interval period. So this is then when they had a chance to ingest the plastic along with the rest of their diet. And so let's say they started with the plastic flakes just for this purposes of this. And so they ingested their regular diet along with the plastic flakes for about a week. And then they assessed what changes occurred. They did what's called this 14-day washout period, which just means they just went back to their regular diet just to make sure that any lingering effects from ingesting plastic flakes were removed. And then they actually went back and they did it again for another couple of weeks, but this time they did the granules. And so what this allowed them to do is compare, is there a difference between these granules and these plastic flakes? And again, the amount in terms of the grams, so you can think of this as like grams of fiber, in this case was exactly the same with both of these. And essentially what they found, and this is what we're going to talk about when it comes to fiber, is that the size and the shape of the food particles is what matters the most. The mass, so the grams or the number of particles, has very little effect on intestinal function. So again, even though it was the same amount of gram of fiber, the flakes or that roughage type of a fiber is what really actually drove that impact. What does this mean from a food standpoint? Essentially, is that what we really want to try to avoid, especially in the midst of a flare, but even if you're experiencing symptoms of really any sort of GI symptom, these large, coarse particles, I think people generally intuitively know this, or you've kind of picked up on this over time, are going to result in increased, again, pulling water into the intestine as well as a faster transit. So you're just going to get, if you're struggling with something like loose stools, it's just going to contribute to more loose stools, especially if there's some inflammation there. These particles hitting against that inflammation is just going to be extra irritating. So this focus on these small, smooth particles can help improve the tolerability of what are otherwise fiber-containing foods. So when we think about this in the context of food, it's going to be a similar notion to plastic. So what is fiber essentially is the plant cell wall. So we see on the The left here, we see these asparagus stalks. If we were to put this under a microscope, on the right side, what you see is that it's composed of just a whole bunch of cells. And these cells are all stacked together like a bunch of building blocks. On the inside of each one of these cells is where we have all of our nutrients, vitamins, minerals, calories, all that other stuff. On the outside, what actually defines that cell wall, that's what we're talking about when we're talking about fiber. And so our goal, when we're trying to improve that fiber tolerability, is to break that. How we go about breaking that, we have a couple of different options, but what we're really looking to do, the more we can disrupt that, the more we can break that, the more tolerated these fibers are going to be. Obviously, at a basic level, there's going to be different types of fibers. So we know on the label there's like soluble, insoluble. There's a lot of different fibers beyond that. This slide, I think, unfortunately, is a bit too much, so I apologize for that. But ultimately, what I want you to take away from this, essentially, is we'll talk about trying to break these different types of fibers up, trying to make stuff more tolerable. But there is, at a very basic level, these very different types of fibers. So we have something like a banana. Obviously, this is essentially pureed at baseline versus something like a spinach leaf, especially like the stem. We have this really stringy fiber. Obviously, there's these, and then something like potatoes. And there's these different types of fibers that are, even as we try to do stuff to break them down, are going to respond differently. So especially like that stringy fiber, like that spinach stem, that one's going to essentially be the hardest one to really get into a more digestible form. But ultimately, again, what we're trying to do is get these foods as essentially as soft as possible. We talk a little bit, you see on food labels, things like soluble, insoluble fiber. Essentially, all that means is that the soluble fibers, if they put them in water, they dissolve. If you put insoluble fiber in water, it doesn't dissolve in water. It's not a wonderful characterization of their functional properties in the body. But ultimately, what's important to take away from this, essentially, is that there are foods, and this is what we're going to kind of steer you towards, that are going to be more soluble fiber-rich foods. Those are generally going to be softer sorts of textures. And foods that are more the insoluble, more your roughage types of fibers. So for example, here, a banana is going to have much more soluble fiber. Something like the spinach leaf is going to have much more of that insoluble, that harder to digest sort of fiber. Again, general goal here is we just want to break those cells. That's what gives that fiber, that structure. That's what allows it to maintain that particle size. So anything we can do to help break that down. We obviously have a couple of options. We can either break it down physically or mechanically. Obviously, the easiest place to do that is in our mouth, just with chewing. But we can also heat foods as well. So heat is actually a really powerful way. Cooking vegetables, cooking even fruits is a really powerful way to start to break that cell structure down. And so it illustrates this really well, and we'll come back to the carrot example again, is carrots provide a really nice example of this. So raw carrots, there's no heating there. All of these cells remain intact. We're chewing the carrot. We're able to break it down. It's obviously not a whole carrot when we swallow it, but we still have a lot of these larger particles. As we start to cook the carrot, we start to get some of this cell damage. So in this case, this was cooked for about 3 minutes. You see it starts to soften a little bit. You get some of that cell damage, and then you chew it a little bit more. You get some more of that breakup. It softens it, makes it easier to digest. And then finally, if we really cook carrots, this one's 25 minutes. I don't know that you'd ever need to cook carrots for 25 minutes. But at that point, it's really mushy. And so the whole point here is that at that point, the heat essentially just destroyed the carrot. When it came to the point of chewing, it was so broken up and it was so softened by the heat that the chewing actually, whatever cells were left that were still intact, actually just there weren't enough cells left intact that your teeth could even break them anymore. It just kind of separated in people's mouths. So ultimately what we're looking for is the further along that spectrum, the closer we can get to that kind of softer texture, the easier this stuff is going to be to digest. This is kind of the the opposite, but still conceptually still the same thing. So there's actually been a decent amount of this type of research done, but it's actually targeted the other end of the spectrum, in that how can we, in like weight loss literature, in terms of how can we limit the amount of calories that somebody is eating or that somebody is getting. And so that's actually where this one is from. But this actually illustrates the same concept that we're trying to go for here. So what we see on the right here, on the furthest right bar, is somebody ate whole peanuts. And so let's just say this is 100 calories of all these different foods. So somebody ate whole peanuts. And so you eat the peanuts, you chew them up. Obviously, there's still these particles. They move through your intestine. And what we see is that a decent amount of fat from the peanut actually comes out in people's stool. It's just undigested. Your body is never actually able to get at that stuff that's inside of those cells. There wasn't enough breakdown. With peanut butter, and that's the second bar from the left, we see that peanut butter, the amount of fat that your body was able to access from peanut butter, or the amount of those nutrients, are exactly the same as if you just ate peanut oil. And so what's really important here, essentially, what this illustrates, is that the more broken down something is, the more digestible it is. And so from an IBD perspective, more of that peanut butter, those nut butters, are going to be more digestible than something like peanuts. So this provides the second way of breaking down these particles, which is mechanically breaking down these particles. This, obviously, peanuts to peanut butter, this requires a certain level of industrial food processing where it's really broken down into really fine particles. But this could even be something in your kitchen, like a blender or a food processor, just anything you're doing to physically start to break this food down. So to summarize all of that was a lot of information. But what we're really focused on when we're talking about fiber is going to be that larger particles, these larger roughage type particles, are really what's having that irritating or that laxative effect. So what that means is that if you can focus on smaller, more uniform sorts of particles, it's going to be less irritating. We can move this direction with things like chewing, chopping, blending, physically breaking it down. But we can also use heating, cooking, to break that stuff up, to disrupt all of that. We see a lot with patients. Patients often comment on that flour-based carbohydrate types of foods, maybe not even flour-based, but stuff like rice, breads, pastas, especially in the midst of a flare, tend to be things that are often well tolerated, better tolerated. This tracks, given that when we're talking about something made from flour, those are all going to be very small, uniform particles. You can think back to that plastic study. So this is going to be that plastic flour, essentially. These same concepts, though, can help you increase, hopefully, some food variety. So from a vegetable perspective, this could be things like cooked vegetables. This is the most extreme, kind of the pureed end. Things like carrots, potatoes coming into the fall, things like squash, pumpkins, beets, although we'd want to be cautious with those. There's concerns for bleeding. But even like peeled, even thinking outside of kind of the pureed side, even something like peeled cucumbers, taking that peel off removes a lot of that potential for those larger particles. Fruits, for the most part, are going to be softer. But again, the more kind of pureed end of the spectrum, you can see things like avocados, bananas, things like peeled apples. Canned fruit can provide another nice option as well, especially like canned peaches, pears. That stuff is peeled or skinned, and it's in that liquid, so it's nice and softened for you. I didn't put it up there, but those same sort of flour-based carbohydrate foods could also include things like well-cooked oatmeal, or even that semi-vegetarian diet in Japan utilizes a lot of brown rice. And so conceptually, again, that would track fairly well, given that if you're cooking it, especially if you're cooking it well with a lot of heat, a lot of water, you can really get that stuff to break down, to soften. And then finally, from a protein perspective, and this is what's going to lead us into our next slide, but this is going to be things like nut, seed, butter. So again, we're trying to move from those whole larger particles down to those smoother sorts of particles. Same with something like tofu. And then finally, things like lean and unprocessed meats. And so we're going to move on to fat on the next slide here, but I wanted to put this up here too, because this also, in theory, given this particle size thing, this indigestibility thing, this could also apply to processed meats. So if you think about essentially just kind of undigestible things, or difficult to digest things like the skin of something like a brat or a hot dog, or even like something like gristle on a piece of meat, or just those harder to digest things that could potentially also be those particles moving through the intestine. So from a fat content standpoint, just across the board, a decrease in fat intake can help oftentimes manage symptoms. This doesn't have to be like a fat-free or a low-fat diet by any means, but especially those high-fat, those greasy things. Again, this is fairly intuitive. Most patients have picked up on this over time. But those higher fat things, especially if you're in the midst of a flare or struggling with some sort of symptoms, they just contribute to things like abdominal pain, discomfort, looser stools, all that sort of stuff. It can alter kind of the bowel movement pattern. And so just kind of trying to limit that fat intake. And again, in particular, kind of those like fried, greasy, high-fat sorts of things. There's something, a concept that's referred to as the osmotic effect of food. And so this has a lot of relevance too, is specifically when it comes to pulling water into the intestine. So we see this a lot. So foods across the board can have this osmotic effect, but where we see the strongest osmotic effect is going to be with pretty much your concentrated sweets, desserts, sweetened drinks, regular sodas, fruit juice, sweet tea, that sort of candy, obviously, that sort of thing. These all have the ability to pull water, and they do so in a really strong way. They pull a lot of water into the intestine. Same with the sugar-free alternative, these artificial sweeteners, especially sugar alcohols, sorbitol, mannitol, xylitol. These all have that same sort of water-pulling effect. And this within this is what we see a lot, again, with kind of where patients end up, especially in the midst of a flare, and even one of our recommendations for diet within ileostomy is to consume more of what are referred to very confusingly as complex carbohydrates. Essentially, that just means like whole food carbohydrates. So things like pasta, rice, potatoes, breads. These things actually have a very limited osmotic effect and actually have more of kind of a constipating, the starches there actually kind of slow stuff down, have more of a constipating effect. And so these things are oftentimes these can be utilized to help kind of slow stuff down potentially a little bit. I threw this in here just to briefly comment on it in terms of alcohol and caffeine. I don't have a great answer for you one way or the other. At least with caffeine, there's nothing to suggest that it's going to contribute to inflammation, but we do know that it is a stimulant. And so especially if struggling with frequent stools, this could potentially contribute to maybe some additional stools, or it can within kind of the IBS, within IBS patients, it can contribute to some symptoms of like gas, bloating. Oftentimes patients kind of do self-limit this, but in terms of an absolute answer one way or the other for caffeine, our best recommendation right now is just kind of in moderation. Same thing with alcohol. We don't have a great answer right now from an alcohol standpoint. Similarly, recommendation there is just generally in moderation. That said, it is a gastric irritant. And so any amount of alcohol, especially in the midst of a flare, is something we're not necessarily going to recommend. We'd probably recommend limiting or avoiding, but just kind of at baseline, our best recommendation generally is kind of in moderation. A lot of those IBD-specific diets do include sometimes alcohol. It's pretty much limited to like wine. It's not necessarily based on anything. That being said, beer with the carbonation, with the the specific carbohydrates that are produced in the midst of fermentation. Patients often comment on not being well tolerated, and that would track fairly well with what it would contain. So things like wine would probably be within alcohol the better options, but again, the recommendation there, I don't have a great one other than just kind of in moderation. And then this last piece here is just going to be fermented foods. I just wanted to comment on this. So fermented foods have a couple of benefits to them. So at a very basic level, when we're talking about this cellular breakdown, when we're talking about softening these fiber sources, they can really help there. So these fermented foods, in a way, you can kind of think of them as being pre-digested. So something like sauerkraut, something like kimchi. I put sauerkraut up there specifically because there's a study where they compared cabbage versus sauerkraut, and they essentially show that the sauerkraut is much better tolerated than the cabbage. Again, somewhat intuitive. But then I put dairy up there too, and so this one is important as well. So in this specific case, part of the fermentation process means that there are microbes there that are going to help to digest specifically those dairy components, especially like the lactose. And so another study compared if you drink milk versus eating yogurt, and even if the yogurt has more lactose than the milk, the yogurt actually ends up being better tolerated. Again, just because you're ingesting along with the yogurt those microbes that are there to kind of help specifically to break down those components of the yogurt. So oftentimes patients can find too that these fermented foods, some of these different options, this is a good way to get dairy into the diet, whether it's yogurt or kefir or like aged cheeses. Those can be good ways to still include some dairy in the diet, which is oftentimes one of the first things to go. So, in a summary, we do not, again, we don't have that defined diet for IBD at this point. We are trying. There's a lot of research being done, but unfortunately, we don't have that one specific diet. That said, there are just some very basic concepts that hopefully can help you to improve just kind of your diet variety and just help you feel a little bit more empowered when it comes to selecting foods. And these get down to the shape, the size, the particle that you're ingesting, and then some of these other things we talked about, lower fat. Again, nothing clear for caffeine and alcohol, and then these fermented foods versus their non-fermented versions can potentially be a little bit better tolerated. And that's it. Thank you.